So I am in here. One of my parents are getting a procedure done, routine procedure. Everything turned out normal. Thank God for that. So I'm just waiting in the recovery room with them. I don't want to show too much, but I'm waiting. I'm waiting, y'all. My parent is doing good. So thank God, just the test and everything came back normal. Thank God. All right, see y'all later. It's just another part of my life that I wanted to show y'all. Just routine things that you have to do with your parents when they get older and stuff, routine tests. So I'm glad that I can help. All right, see y'all in a little bit. Y'all, Jack is finally getting his first pup cup. So we're going to see how this goes. We're going to see if he likes it or not. We have a Starbucks right up the street, and we're going to see if he like it. Baby Jack, look at it. Okay, y'all. Look. I'm getting ready to give Baby Jack his first pup cup from Starbucks. We got it right up the street. I want to see if this dog is he's very funny. Do you like it? Jack is he's very picky. You like it, boo? I don't think he likes his pup cup. Baby Jack. Okay, y'all, so based off of how he acted, I really don't think he like it. What you think?
I don't think he like that good.
I don't think he like it.
Let's see if he put it to the side of his hand. See here.
I don't think. Look, now he just want to rest on my lap.
See if you can squeeze a little bit. Oh, and he take it up to the top. Hey. You can tell he's not crazy about it, because if he was,
yeah,
he'll be tearing it up.
Had this been a piece of meat or bacon or something like that, he would
have been tearing it up.
Yeah, you don't like it, do you? Yeah, he don't like it, y'all. Well, I guess the pup cup doesn't win every dog over, but for the most part, it seems like the dogs that I have seen have liked the pup cups pretty good. But I'm going to Biscuitville. If you all don't know, at least the one here in North Carolina where I stay at, they have dog biscuits. So you can get like a pack of 4 for like $1, and taxes, or just I think you can get more than that. You'll just have to let them know. But I'm going to. He likes the biscuits from Biscuitville. His little dog biscuits. They're so cute, y'all. They're like
shaped like a little bone.
They're shaped like a little bone. They're cute, y'all. So that's what we gonna see. We gonna see if he likes that next. But you don't like it, do you, buddy? He said he don't. He said he
gives the pup cup a what? A thumbs down.
Yeah, he gives it thumbs, paws down.
Is that right, Jack?
Yeah.
You don't like it?
Yeah. I wonder if Ollie would like a pup cup. I doubt it.
Ollie, I don't know. Ollie might eat before Jack.
Jack. Look at the camera. Look at the camera.
Jack. You don't like the pup cup?
Like, no, thank you.
You don't like the pup cup? Jack.
You like, no.
You don't like it?
Like,
You don't like the pup cup? Jack. You don't like the pup cup?
Look at Mama Jack. Look at camera.
You don't like the pup cup? I guess he don't, you all. I guess he likes it. Okay.
All right. We talk with y'all later.
Okay, bye. Say bye, Jack. Say bye.
Hey, y'all. This is Sierra. I hope everyone is doing well. So I want to update y'all on what's been going on in my life. So my life, I would say, it's been crazy the last, I would say, several months. It's been amazing. So many great things have happened to me. I've gotten so many like opportunities to advocate in the community, bring for MS and bring awareness to MS. I've just been on a whirlwind of just a bliss and just so much happiness, and it's been a ride, y'all. It's been a wild ride, but I just thank God. I thank you for your support. My channel, I don't know what's been going on with it lately. I had to maneuver and make some moves. I know I have another channel now. It's under Be Your Best Self with MS Advocacy. And with that channel, I wanted to dedicate it to more multiple sclerosis, information, education, because I am developing a group, a community over there. So I'm hoping that I can get more subscribers on that channel as well. I know on this channel, I want to bring you more into my life. Now, recently, I've done more vlog. I've done 2 vlogs on Be Your Best Self with MS Advocacy, but on this channel, I want to do vlogs as well to let you in on my life, so I can have better connections with people that follow me, that support me. I love y'all. I love y'all so much. Thank y'all for riding with me. I know my videos have kind of been like, where's she going with this? But thank you so much for supporting me. I hope to come out with more related material. But of course, I came out with my book in December, paperback, Multiple Sclerosis, A Bitter Battle with an Uninvited Party Guest. So what I'm doing now is trying to get my book more exposure, as far as putting it into bookstores, talking more about it, because I do think it is a book that will help people living with multiple sclerosis to learn how to face their challenges. Because I think the biggest thing is when you're living with a chronic illness, y'all, I got some stuff to show y'all. So that's why this is in the bag, but I just want to get comfortable. But I feel like the biggest thing, the biggest issue that I believe people have in the beginning with MS, and let me know if I'm wrong, or let me know if this was your issue, is acceptance. Because like trying to accept a diagnosis from the stories from what I heard, especially the people like me who were diagnosed as young adults, we were kind of living our lives. We were working jobs, we was in relationships, and then kind of like the MS came and everything kind of went downhill, and people had to learn to live life again, right? And acceptance is really hard, but I feel like acceptance is hard if you're not willing to accept that change and take on that challenge. And sometimes it is going to be pain accepting that challenge of illness. Nobody wants to be sick, okay? Especially if you're trying to live your life, like live your life and travel and enjoy yourself and not get into too many things. You're just trying to enjoy life, and you now have to find this new way of living, and it can be difficult. It can be difficult at first, and I can say, I mean, oh God, it's so much, it's so many things that I can say as far as like the breakdown of the mind and chronic illness. But if you want to find out more about my journey, of course, my book is not for everybody. There's other memoirs out here, some dealing with MS, some not dealing with MS, that will inspire you just as much as my book, or even more. And I want that for you. I want you to, if you're struggling with like acceptance, I really want you to get to a point where you just let it go. Just let it go. Let go of the fear, the anxiety that will come from it. Because I promise you, it's not gonna, if you embrace your life as it is now and continue to go on, even if you're at your worst, then you will get to your best. And I know you're saying, well, Sierra, you can say that because you're walking around and you're fine now, but I still do have my rough days. And I'm gonna tell you one thing, everything is a trade-off. So don't think just because I'm walking around my life is good because I have a lot of challenges in my life. It's a lot of challenges that you all don't know. Some of those challenges I will reveal to you all. I've been dealing with a female problem really for years, and in my book I talk about it. I have a history of ovarian cyst, and so I've been dealing with that for years. I don't think I've had any recently, but about a year ago I found out that I have uterine fibroids. And if you have read my book, you will be like, Sierra, another chronic illness. Let me know. Do y'all want a part 2? Do y'all want a part 2 to my book? I promise y'all, for the ones who have read my book, y'all know that I had one health issue after the other health issue, after the other, after the other, after the other. And so now I have uterine fibroids, and they are not cancerous, but they are non-cancerous tumors that grow in a woman's uterus. Not all women get uterine fibroids, but it's just, I'll talk more about it in my other video because I'm actually going to show y'all. I was in the emergency room. I was in the emergency room last week, y'all. That's how much pain that I was having in my pelvic area. It was painful. So I'm going to talk more about uterine fibroids on my other video, but just know that's something that I'm dealing with, and I'm just like, oh Jesus, because my periods have always been really heavy and just I don't like the time of the month. And for 3 months straight, I've had 2 periods per month, okay? And they have been super heavy. I was in the hospital. So I'll talk more about uterine fibroids in my other video. But I want to just tell y'all that I'm doing good. But let me tell y'all, insurance tried it. Yes. Insurance tried it, okay? So when I see my neurologist in March, right, everything was good. Y'all know that I'm on Aubagio, and that's like once a day pill, and I've been doing very good with that treatment, okay? And so I went to my neurologist in this past March, and I didn't tell y'all because I wanted to see what the outcome was gonna be, and because I want to tell y'all how y'all can advocate for yourselves. So y'all, I was doing good. I went to my neurologist appointment, and he was saying, oh yeah, by the way, Aubagio, they're making different generic forms of Aubagio, and most likely insurance is gonna have you to be on a generic. I was asking my neurologist about it. It's one of those things where it's just like, this is what they're saying, but let's see if it works, right? And so I was like, okay. And you know, with insurance, they're always trying to find ways to get out of paying, right, a lot of money for patients. So they try to see who can, I feel like they try to see who can tolerate the generics and who can't. 1 or 2 people at a time, or thousands of people at a time, can save the company a lot of money. And so I started taking a generic, I won't say the name right now, but I started taking a generic form of Aubagio in April. And y'all know I was not happy. I was sick, really bad GI, just headaches. It was bad. But the issue that I was having was it was starting to affect my mobility, my nerves, my hands. And I'm just like, okay, y'all know that I've had issue with my legs. I have issue, you know, I have headaches and vertigo, plasticity in my arms and hands. It just depends on what the issue is. And my symptoms are triggered through stress, fatigue, and temperature change. And so I've kind of felt like tingling sensations in my hands. And I'm just like, ooh, I said, all right, I've had those before, but I haven't had it this intense, and it hasn't lasted this long. And so, y'all, I'm out to dinner with my mother and in May, and all of a sudden, girl, I was eating chips, okay? And look, listen, y'all, I know that I need to work on my diet, okay? But we was at Chili's, all right? And you know, guilty pleasures. I like to eat. Okay, I like to eat the wrong foods. But I was eating like a hamburger, a cheeseburger, and some tortilla chips with some sauce. Y'all,
it got to a point, I started feeling like my hands kind of like losing strength. I'm like, ooh, I said, okay, maybe I'm, tired or whatever. And y'all, slowly but surely, my hands just started doing like that. And then I could not use my hands to pick up my chip to eat. And I told my mother, I said, Mom, I said, look at this. I said, record this. I couldn't pick up my hands. My hands was losing strength. And then I started like getting fatigue and stuff. And I'm like, hold on. I'm used to the fatigue, but I'm not used to both hands at the same time kind of like shutting down. I said, okay, this is a new symptom that I've never had before. All right. So a few days later, the same thing kind of happened, but this time I was having issues with, this time I was having issues with my arms. My arms and my hands, the same thing. My hands, kind of clasping together, not able to, grab my food and stuff like that. And I'm like, what the heck is going on? And so, y'all, another time that it happened, it was my worst time. And I said, okay, this is not going to work. All right. So just laying down, of course, I was feeling a little fatigued, but all of a sudden I started getting these bad spasms. I got this horrible spasm in my chest. We just had left Walmart. I felt like I was having a heart attack. And I said, okay, that may be an MS hug. I'm used to having those, but this one felt different. It was just in this area right here on the left side of my chest. And then I felt it through my arms. And I was like, oh, crap. I said, I think I'm having some spasms here. And so, I mean, y'all, within minutes, it went from my chest to my arms to my hands. Lost my ability. Like, my hands was completely froze, like in place. Like, y'all know with plasticity or whatever, paralysis completely froze. And then the whole complete left side of my body just went numb. My legs couldn't move my foot. And I'm like, what the hell? Okay? I'm like, what is going on? And then the other side of my body started losing feeling, and I started just having weakness. And I said, oh my God. I said, I can't do this. But let me tell y'all how slick the insurance company is. When I started taking, because I had ordered again, right? So it was my second bottle. But I noticed that when I had my first bottle of the new generic, right? Tell me why a few days later, they's like, oh, Sierra, by the way, it's time for you to order some more medication. And I'm just like, more medication? I'm like, listen, this is my third or fourth pill out of this 30-day supply. And I'm like, okay, the insurance company is up to something. So I ordered it and I got the pill. But look, and I was on my second bottle of those generic form pills. And all of a sudden, I think I was like my third day, and they was like, oh, it's time to order some medication. And I said, hold on. If I'm having all these symptoms, why in the world would I order another bottle of? Just like my mother says, these insurance companies and neurologists and healthcare team, everybody understands science. But I wrote it down every time it happened, the date, the time, how long it lasted, what was going on, and if it was a new symptom. All right? So that's what you need to do, because that helps the neurologist manage your care, and that helps keep these insurance companies accountable, especially if they're trying to pass off a generic to you. I said, hold on. What's going on here? And before then, y'all, I had gotten a letter, and I had gotten a letter from my insurance company saying, hey, we're going to discontinue Aubagio July the 1st. You have the option on whether or not you want to stay on Aubagio or be on this generic form. It says, but I have until the 1st. And I said to myself, had I ordered that third bottle of medication, I would have messed myself up. Because the goal was for me to go ahead and order it, so that would hold me through July the 1st, and by then it would be too late to say, I need another thing. So what I did, they sent me that notification, and I knew that I was not going to take that medication anymore, because I'm like, I've been good for months now. Like what I've heard from people, some people do very good on generics, and some people like me, I don't do too good on generics. And I said, all right, let me talk to a representative to let them know what's going on. Exactly. I know you say, well, Sierra, why didn't you call? Because y'all, why didn't you call earlier? Y'all need documentation. And I know how I told my neurologist 1 or 2 times, like, hey, you know, this happened. You know, how is he supposed to know? So I had to show that I was having symptoms over a series of weeks, right? I had to write it down. I documented it. I also recorded it as evidence, because you have to protect yourself, right? And I was like, well, let me see what the pharmacy company says that I ordered this medication from. Let me see what they say, because what they're supposed to do, they're supposed to send information to your neurologist in regards to medication. If something needs to be changed, if something's going on with the order. So I knew they would do that. But the first representative that I talked to, and this is another thing, you all, if a representative is not willing to write down exactly what you say, ask to speak with another one. Now, I was on my way to an event, right? Well, my mother was driving and I was on the phone. And so I called, and the representative wanted just to put everything together, right? So she wanted to say, well, Sierra, or she was like, well, you know, Miss Harrison, she didn't say Sierra. Well, Miss Harrison, I'll just tell them that you was experiencing numbness in the hands, you know, weakness in the hands for several weeks. And I told her, I said, ma'am, I said, it has to be more detailed. I said, because they have to see a progression and they have to get a date and time. I said, because if they don't get a date and time, the duration of how long it lasts, and I'm like, they're not going to be able to accurately understand what I'm talking about and accurately see a pattern or trends that will justify me getting back on Aubagio. But she wasn't understanding it, and she was just, I'm not too sure what was going on with her, but God had a ram in the bush. We got disconnected, right? Because we were traveling, and I spoke with this gentleman, and he was amazing. He got it down. He got all my dates down, my times, what I was experiencing, and called it a day. And I appreciate it. I really appreciate that, because he gave that information to the pharmacist, because they have a pharmacist that I can talk to. And what happened was, once I spoke with that pharmacist, she had seen the documentation that I have given to the representative. She was able to just ask more questions, pick up from the documentation. She sent it over to my neurologist. Within days, my neurologist put me back on Aubagio. And that's the power in documentation and knowing your rights as a patient. Even if you have representatives, because some representatives, they don't, some of them are not really trained like they should be, and some of them just don't want to do it. You know, for some reason, they just want to take a shortcut and they don't want to write that. But you need to be very persistent. If you need to get back on your medication, be very persistent while talking with them, because what happened was, with me being on Aubagio, my neurologist, he had to put in a new order for Aubagio. It worked out, but don't feel pressured by your insurance company to order medication that is not right for you. I wouldn't have had a leg to stand on, because they were like, well, why did you order another medication? Why didn't you tell us earlier? Why didn't you tell us sooner? I mean, it's a money issue. It's a money thing, y'all. If you want to be honest, it's a money issue. It's a money thing. And insurance companies are looking to save as much money as they can. But don't be playing those games with them, and make sure you write down everything. And see, those were new symptoms too that I've never gotten. I mean, I've had issue with my hands, as y'all can see, but I'm trying to grab my burger, trying to grab my food, just hands frozen, stuck like that, you know, for just longer than 30 minutes to hours. I'm like, that ain't gonna work. But I know that was a long explanation, but I just want to tell y'all that y'all need to continue to advocate for yourselves. I've been trying to get back on my feet. I have felt better, but dealing with the uterine fibroid issue and trying to get back on this treatment, I've just been so tired. I'm just like, Lord have mercy. But I'm gonna get back to where I need to get to, y'all. But I know that was a long explanation, but I just want to talk to y'all, because when on this channel, I don't really get a chance to talk to y'all, because everything is structured. Like, if I'm not doing a product review, I'm doing Wellness Wednesday. Sometimes. If I'm not doing Wellness Wednesday, I'm just talking about something that's MS related or talking about my life. Everything is really structured. So I wanted to kind of bring y'all into like my world and what's been going on with me. But y'all, your girl is going on a trip. I can't wait to show y'all. I can't wait to show y'all footage for my trip, y'all. I am just so excited about it. It is for my birthday, and I look forward to going there. I've always wanted to go there. It is a tropical place. I always wanted to go there, but I want to show y'all what I got. So the first thing I want to show y'all, I'm gonna say the clothes for last. All right, so y'all, like, I noticed something. I'm like, when I go on vacation, like, it's nothing for me to take a trash bag and put my toiletries in. And I'm like, I need to stop that. I need to find a better way. Because my sister, when we went to the Bahamas for my mother's birthday in February, my sister, she had it going on. She had her a little small travel size case. And she had her toiletries in there, her makeup, everything. And I said, I need the same exact thing. Because I was looking all over the place, bags here, bags there. I said, this can't happen again, honey. So I got this from Walmart. And I don't know how much it is, y'all, but I forgot. I'll put it in the description. But it is a 6-piece weekender set. It says water resistance, and you can see what, y'all see that? So it says it's for your bottles, jewelry, cosmetics, cable wires, and toiletries. So with this, y'all, I want to use this for my toiletries. And my cosmetics. So this is really cute. I need to get some scissors to cut this. Okay, I got some scissors, y'all. So let me cut this a little bit right here. Y'all, I don't know if this is the company or not, but this little bitty thing, how they expect for me to cut that? Let me try to see, y'all. Oh my God. Jesus. Ooh, y'all, I finally got it. Lord Jesus. Look. About poked my eye on the process, though. I'm playing. All right, y'all. So let me unzip this. What I like about this is it's clear, so I know what I have in it. It has another little clear bag that's attached to it. It has a squeezy or whatever. I don't use these, y'all, so I don't know what they call. I forgot. I haven't used one of those in a long time. Ooh, they have a cute little black bag in here, and they have 2 bottles right here. You can put some soap in it, or lotion, or powder, whatever you choose. So I like that. Put this back in here. So I'm definitely gonna take advantage. And look, y'all, look how big this thing is. Like, I can put a lot in here. Oh, oh God, y'all, I don't got no sense. All right. So I really like that. And what I did, and this is very similar to what I had in one of my other videos, disability hacks. It's very similar to it. And so what I ended up doing, I got another one. So they sell these individually, and I love these. Like, I can put like I don't know what I'm gonna put in this, because I have another one where I keep like my pill cutters, some of my medications, some other little things in it. But I'm definitely gonna use it. But I know this is big enough to fit in here, which it is. And look, so this is what I'm going to carry on my trip. I'm gonna put it on a carry-on bag. And one thing I learned, y'all, and let me know what y'all are. Y'all like carry-on bag people, or do y'all like to like check in y'all luggage? Because first of all, like, checking in luggage, it can, depending on the situation, it can kind of be a hassle at times, and it can kind of be a little nerve-wracking, because you want to make sure that your luggage arrives on time and you get your luggage, right? You don't want to leave your luggage. You don't want your luggage to be lost. And then, you know, people are not as honest as they should be. You don't want people to take stuff out of your luggage. So, out of your luggage bag. So that can kind of be a little nerve-wracking. So the last few trips we went on, we've done carry-on. And I feel like when I check in luggage, I take too much stuff. I feel like I take way too much stuff, y'all. So, this should fit perfectly in my carry-on bag. As I get closer to my trip, I'm gonna let y'all know what I have, but this is some of the things I'm bringing. I have some Kleenex, and y'all know what I said in my other video. Like, I use the bathroom a lot, and there's been some situations where there has not been any tissue, or the tissue has not been clean. It's been out exposed to the elements, and I just have a fit, y'all, when that happens. But you got some of these on you, ladies, in your purse, or fellas in your pocket, or whatever. Use that. Got me some Lysol wipes. Yeah. And then I got me travel containers. I had to get some new ones. Got these from Walmart. And I wasn't playing with the tissue, but of course I'm not going to take all the tissue. And then I have some wet ones. Could never go wrong. I actually like using wet ones compared to hand sanitizer. I feel like I can get like the grit and stuff off. And then I got this peel case. Now I have a smaller one, and I don't know. It depends on the situation, but I'll do another video as far as packing my medication, because my medication is very important to take. Of course, I have my MS medication. I have my medication for my bladder, and I need my Tylenol, and I need my vitamin D. I need my iron pill. So it's gonna have to be a certain way. My stuff is gonna have to be packed. But of course, I'm not carrying that large case with me, so I'm gonna have to figure out how I'm gonna do it. But what I like this, if I was to use this, is big enough to fit in here. That's what I like. It's big enough to fit in here. Be no problem. So most likely, I'll probably take this with me. I'll most likely be taking this with me. So I'll put that right there. All right. And I don't know if I got this from Walmart or Target. It was one of those places. It's a little Lysol. I don't know if it's focusing or not, but I got a Lysol to go. Of course, I'm going to have more of those. And y'all, I got these cute little baggies from Dollar Tree. Now, you know, nothing is $1 anymore at Dollar Tree, and I knew that was going to happen eventually. Talk about some inflation or whatever they talking about, but trying to mess a good thing up. They trying to mess a good thing up, y'all. All right, but this is a cosmetic bags. So I don't know whether, can y'all see that pattern? The pattern is so pretty. I don't know whether I'm gonna put my makeup in here or not, but what I like is big enough to fit in here. Like, everything can fit in there. And I got me some wig caps, y'all, because y'all know I do wear wigs. I do wear wigs. I have like a protective hairstyle, so my hair is like braided underneath my wig. But I'm gonna show y'all a video of my hair getting blown out. Ooh. I'm gonna show y'all a video of my hair getting blown out, so y'all can see how long my hair is. Like, my hair is like right here. I have long hair. It's thick and it's gorgeous, and I can't wait for y'all to see it. So I was like, am I gonna wear braids or am I gonna wear wigs? And I know for me, like, if y'all haven't noticed, I like to wear different types of hairstyles. I have that type of face, not trying to brag, where I can wear short hair, long hair, medium hair, wavy hair, curly hair, straight hair, and I will look good. And I can wear different colors. I can wear different types of colors of hair. I can wear different types of hair styles, and I can wear different colors. So I'm like, let me get me some fresh wig caps. I just maybe need like one or two. I got this from Walk MS. I got this from Walk MS Triad. It was this Walk MS Triad or Raleigh. I don't know whether this was Walk MS Triad or Walk MS Raleigh, but Abagio was there out there. And I was thinking about, I don't know, I may put this in here. I don't even know if it's gonna fit, but if not, I may not even bring this, but I'm like, this is a good bag right here. And it's the medication that I'm taking. So good advertisement. It's been working for me. Insurance tried it, but God worked it out. Thank you, Jesus. Okay, so I'm gonna put this back in. Okay, so ladies, so girls, I got some cute outfits, right? Look, y'all will find out about me that I don't like spending a lot of money. I'm very stingy, and like I said, that show on TLC, God, what was it called? Where those people just extreme cheapskates or whatever. I'm not extreme, but I am a cheapskate, and I will use something till the wheels fall off. And no lie. All right, so this is a dress that I got. It's cute pattern. The back is really cute. I'm not trying it on because, you know, my little belly is swollen right now, so I'm not pregnant. My little belly is swollen right now because, you know, the uterine fibroid situation, and I need to push back from the fries and stuff. So once I get that together, I will show y'all. But this is really cute. I love this pattern. It's very colorful. And then I got this little cute dress right here, and all of this comes from Walmart, y'all. And this is No Boundaries. And look, y'all, that stuff was on sale, like $11, $12, $13, $14, like that. And then it's just really cute. Let me know if y'all want me to do a try on haul. I think I'm gonna do a try on haul on this so y'all can see like what I'm wearing, how I'm gonna style it. And this is a cute little set right here. I like this little yellow set. So this is the top. That's the top. And it kind of has like a little, this kind of goes around like that. Top. And then I have these shorts right here. Now they like, see here, these shorts are short. Yeah, they are, but y'all have a flat butt if y'all haven't already noticed. So these shorts actually look pretty good. They look pretty good on me. And I have this cute little shirt. I'm trying to figure out what type of bra I'm gonna wear with this, but I gotta do a clothing haul for y'all with these clothes on. Like, this is what I'm wearing to my little tropical birthday trip. I'll be 33 years old, y'all. I'm so blessed to see that age. Lord, thank you, Jesus. I pray I get to see that age. I pray I get to see it. 32 has been good to me. All right, and these are some little shorts, y'all. Some little shorts. I was thinking about wearing it with that white shirt, but I love colorings. I love patterns. If you haven't noticed, me and my mother, we like colorings. We love patterns. We like blonde hair. Yes. So that is all, you all. That is all for today. But I hope y'all take care, and I will see y'all on the next vlog. Bye.